Okay. And a very good morning, JC Tinsley in studio here at Roy Radio 93.3 FM, also AM 1460 WROY, 97.3 WRUL, and we're on the World Wide Web here at WRUL.com and on our social media pages. Very happy to be joined today by the CEO of our local Egyptian Health Department, Mrs. Angie Hampton. How are you today, Angie?
Great. Thank you, JC.
Pleasure is mine. I really appreciate you taking some time out of your day. I know you are very busy. Uh, I want to talk specifically about an event that's coming up today, but I also, since I've got you, I'd be remiss if we didn't just back up and look at the pandemic over the last 12 months. It, can you narrow it down if I ask you, what has the last 12, 13 months been like for you? Is that something you can, have you been able to look back on it, or do you feel like we're still in it too much for you to even process that?
Oh, no. Actually, I think we have certainly for the last month or so had, time for reflection of where we've been for a little over a year now, and the response that Egyptian Health Department, in partnership with our other healthcare partners, it's been a long year. But I have to say, JC, as a local public health department, when the pandemic began, we were ready. As local public health departments are required to have pandemic plans in place, and we have a structure, an incident command structure in place on how we respond to any type of public health emergency. So, and we've exercised those, over the years, and we implement those plans. So we were more than prepared for the pandemic. I will tell you, we have all stated many times, I think we weren't prepared for how long we would be responding to the pandemic. But, we've certainly, we were ready in the sense that, we knew exactly how to activate our plans and what we needed to do. And with the leadership from Illinois Department of Public Health, we were able to really respond. And we've been very grateful for the support that we have received from our communities at large, in how they've all also personally responded to the pandemic. It's been a long, tough year for everyone,
Imagine
particularly.
so.
So, but I'm very proud of our organization, very grateful to our communities, and really for the praise and appreciation that they've given to all of us, but also for their patience, because it's not always been easy. Particularly when the vaccination planning or the vaccination clinics were starting, and we were getting so very limited vaccine in the very beginning,
Mhm.
and trying to get the clinic scheduled and get the vaccine out. Our goal was always, as soon as we could get it in hand, to get it out as quickly as possible. And, for a long time, we were looking at 200 doses a week for a 3-county area of, 45,000 people plus. So we were really, that was a really tough time, but we were committed to just, working on it diligently around the clock every day. And I will say our response team, I can't say enough about the excellent work that they've done. We worked 7 days a week for, well, almost a year.
Right.
I can say that load has definitely lightened up over the last couple of months, but I'm just really grateful to, everybody was here, everybody was ready, even when they were tired, they continued on. So, and of course, all of our healthcare partners doing the same, and as you know, this affected everyone. So it wasn't just about healthcare, and our schools. I can't say enough about the hard work that our school districts have all done, from their leadership to their school nurses, give those school nurses, this week especially, give them a huge shout out because they have been phenomenal this school year.
Yeah, absolutely. Now we get almost daily, it seems like, updates on vaccines and whatnot, and we're seeing trends throughout the country that vaccines are slowing down. I think the latest report I saw this morning, the Illinois Department of Health said like 60% of adults are now have at least one vaccine. And I think we're somewhere around 33%. Yeah, you know better than I do.
You're absolutely right.
Are we seeing the slowdown here as well? Do we have data on how much of our counties are actually vaccinated, or has that not trickled down yet?
Yes, that data is definitely out there, and we're right. I mean, we're right sitting at those percentages, well over the 30%.
Mm-hmm.
And actually, we are, now we have plenty of vaccine to be
Right.
able to get out to the communities. We are doing all types of different clinics at this point where we're doing outreach to large businesses or housing authorities. And then we've actually started this week in-office walk-in clinics. So somebody can walk into one of our offices and either get the Johnson & Johnson vaccine or Moderna. And that's at 1 o'clock today from 1 to 6 at either Carmi or our El Dorado office. And people just have to walk in. So it's much different than where we were, a few months ago.
Yeah,
So,
definitely.
and we want to continue to get that information out. We're waiting to see what's going to happen with Pfizer for the 12 to 15-year-olds, and we'll potentially then, once that starts, we will be having the Pfizer vaccine available. Plus, a lot of our partnering pharmacies carry Pfizer already, where they will be able to go and get the vaccine there.
Okay, brilliant.
Well,
And another, and specifically pivoting to an event that you've got coming up today, something that is one of the many, I guess, side effects of a pandemic is mental health. And we have seen I think it was Chrissy Braden that I talked to. I don't know, it's been a handful of months ago, but we talked about the impact that it was having on people sheltering in place, and just what it does to you to have a complete departure of your normal lifestyle. Now today is National Children's Mental Health Awareness Day, so talk to me first of all about the event that you've got coming up today.
sure.
I'm sure
So,
you have multiple events.
yes, our agency, every year, we really promote Mental Health Awareness Month, which is in May. And then today is National Children's Mental Health Awareness Day. So on this day, every year, we do several different events at in all of the counties that we serve. So Saline, Gallatin, White, Wayne, and Hamilton this year as well, where we just paint the town green. We encourage everybody to wear green. And then that really we do several different types of events where we'll be live, Facebook Live today at noon with a lot of information. We have lots of different, each county has something going on. We've really partnered with the school districts to promote National Children's Mental Health Awareness Day. So they're all doing a lot of great activities. Today in Carmi at Jefferson Attendance Center from 4 to 6, we have a drive-through for mental health awareness where we'll be giving out, and it's rain or shine, so we'll have there'll be some food, mental health resources, some other types of goodies and different types of hygiene items and things like that. So it's a drive-through. And we encourage everybody to come out and learn more. And that's at Jefferson Attendance Center there in Carmi today, which, they're always great partners and really do a lot around this. And every year they help promote National Children's Mental Health Awareness Day, as all of our local school districts do. But So that's what's happening in Carmi today. And as you said, JC, the last year, when you think about the topics that we've heard about the most, so, in the news, you have COVID-19, racial injustice, the presidential election, and then a lot about mental health. So we've been hearing a lot about that in the news, and we see this as a time where, as a nation, we can really act to actually the theme for National Children's Mental Health Awareness Day is flip the script. So we see this as an opportunity. People are talking about it. We can actually break the stigma of mental health, and for people to understand that it is okay, if they're not feeling okay, and that, taking care of your mental health is extremely important, and to really break down that stigma. And we really want to be there for our children and to help them understand that. I know you've heard about it. The schools are talking about it. Families are talking about it. Our organization has been talking about it and preparing on, we already provide children's mental health services, and we provide a lot of education in the community. But during the pandemic, kids especially, we need to really stop and think about how this has impacted them. It's impacted all of us, but think about how it's impacted them, and not just what school has looked like for them. And as we know, school has been extremely different for them. Many of them, whether they were doing virtual learning or in person or some of both and pivoting back and forth, they still didn't have access to those social connections that are so important for support for them, whether it's their family or if friends at school, their peers, teachers who look out for them, coaches. So many of them missed out, and even think about the seniors last year too. My daughter falling in that category of last year, graduating in 2020, they missed out on so many rites of passage, that are so important, things you look forward to all throughout school, and then, you have to appreciate it or recognize it in a different way. So just thinking about, and there, even this year, sports, I was glad that many of the schools got to participate in sports. I think that's so important for kids, but we know it looked very different for them. So just all of that, thinking about the clubs and the connectedness that kids feel, through school and in the community, and just paying attention more so to that. We have some plans of things we want to do. Today, what we really want to do is bring awareness about children's mental health and to break that stigma, and for it to be, that everyone understands that it's part of your just overall health. The word mental health should not be associated with something negative. Our physical health, we talk about that all of the time. But when you talk about mental health, people immediately start thinking about problems, right? When you talk about physical health, what do you think of? You think about taking care of yourself and exercise and nutrition and things like that. And when they talk about mental health, they tend to more focus on problems, well as anxiety and depression. And those things are things that we have to talk about, but the overall mental health is just talking about really that connectedness and taking care of ourselves. So mental health is just really important. And I would say that, we've certainly been talking about it. Now's the time for us all to just keep talking about it and to really break the stigma.
So as far as the resources that are available to folks, whenever it comes to Egyptian Health Department, if they've got a child that they've been they feel like maybe they're at risk, or they just need some help, or they want to find some resources for their child, whether it's theirs or a niece or nephew, can you talk about that. What resources are available, and what's the best way to get in contact, whether it's Egyptian Health Department or.
So there are many opportunities. There's actually no wrong door for getting into services, and we recognize here we've certainly seen an increase in referrals for mental health services over the course of the last year, particularly the last few months. And we have lots of other partners who also provide mental health services. So we would either, they can call one of our offices. We also have connections within the school districts where we have family resource developers who are located in each school district. And if they don't have a family resource developer, we have other counselors or health educators that work with those schools. So we have a very strong presence in every school district. So those students can actually go to those individuals or be connected by a teacher or administrator, someone to be connected in the school. And some of our schools have mental health counselors on site, so they can actually be seen at school. If they choose, you know, the child and the family can choose if they want to talk to somebody at school. Not every district has them on site. Sometimes they refer for us to come in, or they can come to one of our offices. So they can call our office, they can contact us in any way. There are staff at the school that know exactly how to refer and connect to our organization, as well as our other mental health partners. So, and that's the main thing. It's, we want a child or anyone to be able to access services anytime, any place that they need. And we would like to be able to intervene with them earlier rather than later. So when a child and I say child, but I'm referring to, you know, children and adolescents, that as soon as they, you know, start feeling not okay, there can be some type of early intervention. Or if parents just want to ask, what can I do to be more, you know, supportive to my child and help them, you know, kind of get through this tough time. We offer a lot of parent education classes like that. So there are the resources, and I understand that sometimes it's hard to navigate, but just by calling and talking to someone at our office, we have a very large child and adolescent division. And then, like I said, we have those staff in the schools that we connect with as well.
Brilliant. Thank you so much for your time this morning. Is there anything I missed that that you want to add?
I don't think so. I think like I said, we really appreciate you guys. You know, all throughout the pandemic, you have been checking in and making sure that we were, you know, that the information we were giving you so that you could get it out to the communities. I mean, we couldn't have done it without you guys.
Well, I appreciate it. I apologize. I feel like I'm annoying at times, but
no,
I appreciate you guys always being there to answer the call.
Yeah, no, we think it's extremely important. I mean, there's only, you know, we're limited in how much information that we can just, you know, post on our social media and our websites and all of that. So we need all of those extra voices. So we've appreciated it, appreciated the partnership, and just everyone remember, today is National Children's Mental Health Awareness Day. Wear green, talk about it. And let's flip the script so that we can really break down the barriers and focus on mental health the same as we do our physical health.
Brilliant. Well said. Yeah. CEO of Egyptian Health Department, Angie Hampton. Always a pleasure to talk to you. You have a great day. Thank you so much.
Thank you.